Oropharygeal, nasopharyngeal sunctioning. Nasopharyngeal and oropharyngeal sunctioning is performed to remove mucus or saliva from the back of the throat when a child cannot cough or swallow. Make sure you know how to use the suction machine and equipment before you begin suctioning on your child. Nasopharyngeal suction is indicate when there is evidence of retained secretions but the child is not able to clear the secretions independently and secretions are too low down in the airway for the oral suction. For oropharyngeal suctioning, advice called a young career suction tip is typically used for suctioning mouth secretions. A device is rigid and has several holes of suctioning.
So now we're going to review oral suctioning with the Yonker or handheld suction device. In most facilities, it looks a lot like this when it's a wall device. It's got the yellow vacuum wall piece, and then it has the suction apparatus attached to it with a dial to tell you how much pressure it's sucking, and then also a dial to tell you whether it's increasing or decreasing the level of suction. Then there's a red tubing hooked up to the canister that's attached to the wall, and there's an inner canister that you can change out, obviously between patients and when it's full. So you want to make sure that system is monitored and you can change it out if and when needed. And then to actually suction from your patient, you'll get suction tubing. So it's this larger bore, thick plastic tubing, and it doesn't come with this attached. It's a separate a piece, but the Yonker suction. So that's this handheld piece like this. It's a lot like the one that you use at the dentist when they give you that handheld suction to suck out the excess saliva. So if we set up all our equipment here and our patient is wanting to just hang on to this to help him clear his, he's expectorating, but he's having a hard time maybe spitting out the secretions, we can use this. This is just an oral suction, so it will just kind of go in his mouth. It's not intended for deep suction. It's just for in the mouth, and he can hold it and do it himself, or you could help him with it as well. So this one, the catheter doesn't need to remain sterile, just clean. So he can use it and then put it back in here to maintain its cleanliness when it's just sitting on the bed. So to turn it on, you would hook up all your apparatus, and there's an on-off switch back here. We already had it turned on, but when you do first turn it on, it's usually starts at 0 and you just have to increase the suction. So for an adult, it's roughly, for safe oral suctioning, 100 to about 150, but you'll see there's parameters here of green, yellow, and red for the amount or level of actual suctioning that you're getting. So you can hear it suctioning right away. You can ask the person to try it out, see if it works on their oral secretions, and you'll see them get sucked back into the canister. If ever you want to or need to clear the tube out, you can stick it into a sterile water container, water bottle, such as this one here. So you open up a new one and then stick it in there, and then you could clear it out that way, or oftentimes what we'll do is just replace the tubing if it gets kind of yucky and clogged, or it's starting to look a little clogged, because that will impair the level of suction it can deliver. So that's kind of the basics of oral suction device.
Pharyngeal suctioning, advice called a young career suction tip, is typically used for suctioning mouth secretions. A device is rigid and has several holes of suctioning secretions that are commonly thick and difficult for patient to clear. Suctioning stimulates the vagus nerve in some patients. This can trigger episodes of bradycardia as well as related symptoms such as fainting and lightheadedness.